Good evening, everyone. My name is Bob Peskin, and tonight we're going to be spending some time talking about Sprix, a preparation of ketorolac tromethamine, which has been very useful as an alternative to prescribing opioids. Before we get started with this webinar, which will probably take the better part of the next hour or so, I'd like to spend a few minutes spending some time just giving you some background and disclosures about me. As you can see, I grew up on Long Island, and in fact, grew up in a little town that was in the shadows of what at the time was Idlewild Airport and is now John F. Kennedy Airport. I went to college, undergraduate, at Queens College, which was part of the City University of New York. And from there was accepted into the first graduating class from the dental school at the State University of New York at Stony Brook. Following dental school, I had the opportunity to do a general practice residency, which I did at Long Island Jewish Hospital and its Queens Hospital Center affiliate. Since 1994, I've been in private practice in Garden City on Long Island. And in that practice, I've been involved in the management of patients who are apprehensive and anxious, as well as a fairly large population of special needs patients. And it was my anesthesia training at Long Island Jewish that's enabled me to take care of these patients over the last 35 plus years. Most recently, I've taken on the responsibilities as the director of the dental anesthesiology residency program at Wyckoff Heights Medical Center, which is located in Brooklyn, New York. Our residency, which I'm going to explain a little bit further about, has provided me an opportunity to expand my administration of anesthesia services. So I'm a general dentist, but I'm also a dentist anesthesiologist and a program director for the dental anesthesiology residency, as I've mentioned. Further disclosure, I should let you know that I'm a paid consultant and lecturer for Septodont, who was the sponsor of this evening's webinar, and have also been a consultant for Orapharma as well. As it relates to our residency program at Wyckoff Heights, we have a 3-year program now, and in that 3-year program, there are 3 residents in each of the 3 years. And from the dental side of things, our residents have an opportunity to provide the full spectrum of anesthesia services, from moderate sedation all the way through general anesthesia. And they get a great experience in not only managing patients with endotracheal intubation, but they are quite proficient in nasal intubations as well as other advanced airway management maneuvers. We treat a lot of children, a lot of special needs patients, many ambulatory patients, as well as a very significant geriatric patient population. And our residents do get a chance to treat some patients that are at much higher risk for anesthesia. What we're going to talk about tonight is Sprix. And the reason why I gave the introduction I did is because Sprix, which is ketorolac tromethamine, in this application is the first and only intranasal nonsteroidal anti-inflammatory drug that provides pain relief at the opioid level. My experience, however, with ketorolac goes back many, many years when I was providing anesthesia services at Long Island Jewish Hospital. Back then, this was a drug that was made available via a parenteral route of administration, intravenously. Also, it can be used intramuscularly. And at the hospital setting back then, we found this to be a very useful medication for the management of postoperative pain. In fact, at that time, ketorolac was also available in an oral version, which was used quite readily by many of the periodontist and oral surgeons who I interrelated with throughout my career. However, several years ago, the FDA initiated a restriction on ketorolac in the oral form. And at that time, it was unable to be used anymore unless a parenteral dose, that meaning an intravenous or intramuscular dose, had first been administered. So for many of the practitioners who got very comfortable with ketorolac as a nonsteroidal, which they felt to be very beneficial, their hands were tied somewhat. If they were to write a prescription, they would get a phone call from the pharmacist asking, Was there an intramuscular or intravenous dose administered prior to the oral dose that you're writing the prescription for? And many times they would find difficulty in getting that prescription filled. That led many of the practitioners to going in another direction with regards to postoperative pain management. Well, I needn't have to tell you that over the last several years, one of those options, the use of opioids, has come under continuing and increasing scrutiny, not only throughout our profession, but in the lay press as well. And in fact, many of the issues related to opioid administration have resulted in some of the laws that we're dealing with here in New York State. The I-STOP legislation, the fact that we now have to do a background check on patients for whom we are prescribing opioids has become a significant impediment to the administration and use of opioids. Most recently, in New York State, we've actually implemented an e-prescribe type of law, where as of March 27th of this year, we've had to administer all medications, narcotic or non-narcotic, using an e-prescribe, an electronic prescription, which has put somewhat of an extra barrier in our ability to do what we need to do in terms of managing postoperative pain. Also, because of all the things that have been published in both the lay press and the professional literature, it's become apparent that many dentists, primarily those performing surgical procedures, have relied perhaps too heavily on the use of opioids, prescription opioids, for the management of postoperative pain. And the literature has been replete in demonstrating that the appropriate use of nonsteroidal anti-inflammatories is a very, very useful adjunct which could minimize the amount of opioids that need to be prescribed. So how does this all relate to Sprix? Well, Sprix is a very unique formulation of ketorolac. As I said, it was a drug that was found very useful by many practitioners through, over the last 20 or 25 years. However, because of the restriction and the need to have a parenteral dose, that was the thing that was handcuffing many practitioners from using it. But as an intranasal nonsteroidal, that requirement of a parenteral dose first no longer exists. And now you have a drug that's been proven to be very effective as an analgesic, that is a nonsteroidal, that can be administered via another route of administration without that severe restriction. Let's talk a little bit more about Sprix, understanding that there are certain restrictions that do exist for this drug that we have to be cognizant of. And as we go through these next few slides, you'll get a sense of some of the issues that may impede your ability to use this for certain patient populations. Understanding, of course, this is a drug that's intended for adults over the age of 18. There are some serious cardiovascular and gastrointestinal events that can occur with the use of this drug. For that reason, there is a boxed warning that appears on the package insert that if you're going to use Sprix, we would encourage you to become somewhat familiar with. You see here that nonsteroidal anti-inflammatory drugs can cause an increased risk of serious cardiovascular thrombotic events, including myocardial infarction and stroke, which of course can be fatal. And this risk may occur early in treatment and may increase with duration of use. And that's for all nonsteroidals, not just ketorolac. There are certain restrictions that are unique to ketorolac. In this case, Sprix is contraindicated in the setting of coronary artery bypass graft surgery. And you should also be aware that NSAIDs in general cause an increased risk of serious gastrointestinal adverse events, including bleeding, ulceration, and perforation of the stomach or intestines, which could be fatal. And these events can occur at any time during the use and without warning symptoms. In particular, elderly patients and patients with a prior history of peptic ulcer disease and/or GI bleeding are at greater risk for serious GI events. However, this is the first and only intranasal nonsteroidal that's indicated for short-term management of moderate to moderately severe pain that requires analgesia at the equivalent of the opioid level. What's really terrific about this drug is that it is a potent NSAID that's rapidly absorbed through the nasal mucosa. And it is not a controlled substance. In fact, it's a novel formulation of a drug that we've had around for a while, ketorolac. It provides opioid-level analgesia and can be used for short-term pain relief of up to 5 days. So it's indicated in adult patients for the short-term management of moderate to moderately severe pain requiring analgesia at the opioid level. And as we indicated before, there are a number of contraindications. Of course, known hypersensitivity to ketorolac or any of its components, a history of asthma, urticaria, or other allergic type reactions after taking aspirin or other NSAIDs. Knowing that some severe, sometimes fatal anaphylactic reactions to NSAIDs have been reported in such patients. We talked about cabbage surgery. We also have to be somewhat cautious in patients with active peptic ulcer disease or with recent gastrointestinal bleeding or perforation. It's also something that should not be used as a prophylactic analgesic prior to any major surgery. In fact, you should be cautious for use in patients with severe renal disease or patients at risk for renal failure. And there are certain restrictions on patients who are in labor and delivery, which doesn't really affect us too much, and patients with suspected or proven cerebrovascular bleeding issues. What's interesting about ketorolac in a nasally administered preparation, an intranasal version, as is Sprix is that the time to maximum plasma concentration is similar to that of IM, intramuscular ketorolac. So that a single dose of Sprix, 31.5 milligrams, delivered intranasally will have a very similar profile to that which you would find if ketorolac was to be administered intramuscularly. And this is a study that was published some time ago. Again, understanding the safety information, the warnings and precautions is something that you just have to be pretty comfortable with and understanding of. Patients who have cardiovascular thrombotic events, patients who have gastrointestinal bleeding, ulceration, and perforation, who have hepatotoxicity, who are hypertensive, who have heart failure and edema, those that have renal toxicity and hyperkalemia, or who have experienced anaphylactic reactions, or those that may have exacerbation of asthma related to aspirin sensitivity, or serious skin reactions, those patients or those groups of patients, extreme caution should be exercised prior to the use of Sprix. Again, you're cautioned to become extremely familiar with the package insert with the drug before you use it. There are two studies in particular that we look at to tell us about the efficacy of this drug. Now, admittedly, neither of these studies is on dental patients. And I would imagine that in the time to come, in the near future, we will have dental studies that will give us a greater insight of the use of Sprix in the dental setting. So for the time being, we have to rely on these two phase 3 randomized double-blind placebo-controlled studies to evaluate the analgesic efficacy and tolerability of Sprix. In the first study, this was a study that was designed to evaluate the analgesic efficacy and tolerability of Sprix after both abdominal and orthopedic surgery. And in this study, as in the other study we'll talk about in a few moments, it was weighted so that twice as many patients were being administered Sprix, and the 1/3 of the patients was simply getting placebo. And in this study, patients received the Sprix, 31.5 milligrams intranasally, or placebo 3 times daily following surgery for a period of time up to 5 days. If there was breakthrough pain for these patients, they did have access to morphine that would have been delivered by a patient-controlled analgesia pump, a PCA. And in this study, patients were able to record their pain intensity ratings using something called a visual analog scale. What a visual analog scale is essentially a 100-millimeter line. And if a patient is not experiencing any pain, they would place an X all the way to the left at the 0 point. And if they were feeling maximum, unbearable, intolerable pain, they would place an X on that line at the right end of the line, which would be 100 millimeters from the beginning of the line. And with that type of a system, a study, you're able to actually measure the pain intensity as perceived by the patient. Patients that would record a pain intensity of greater than 40 then were able to be considered for the study either to receive the Sprix or the placebo. The second study was somewhat similar, and that evaluated the analgesic efficacy and tolerability of Sprix simply after abdominal surgery. And in this study, there were 21 adult patients, 2/3 of them receiving the Sprix and 1/3 of them placebo. Here, the patients who received Sprix received it, either the Sprix, 31.5 milligrams, or the placebo 4 times a day following surgery for a period of time up to 5 days. And once again, these patients as well had access to morphine via the patient-controlled analgesia pump. Patients similarly recorded pain intensity using a 100-millimeter long visual analog scale, and should the number that they marked be greater than 40, they were eligible to receive either the Sprix or the placebo. Now, what are the results of these 2 phase 3 studies? You can see on the y-axis here the summed pain intensity difference over a 48-hour period, the SPID, comparing Sprix plus morphine to placebo plus morphine. And here you had a significant difference in the efficacy of those patients receiving the Sprix for control of pain. Similarly, in the second study, you had a similar type thing. In that first study, patients taking Sprix required 36% less morphine over that 48-hour period. In the second study, the one dealing strictly with abdominal surgery, patients here were taking Sprix required 26% less morphine over the 48-hour period. The conclusions here is that the efficacy of Sprix nasal spray was demonstrated by a statistically significant reduction in pain versus placebo in acute pain studies of post-abdominal or post-orthopedic surgery patients, and for the second study, simply post-abdominal surgery patients. Now, before we get too far afield, I do want to make a comment about the administration of Sprix, and we'll get into this a little bit later on. But understand that Sprix is provided in a very unique type of delivery system that's strictly intended for intranasal use. And the dosage of 31.5 milligrams is metered, meaning that every time a spray is ejected from the vial into the nose, it actually delivers 15.75 milligrams of the drug. And at any one administration time, it's intended for the patients to get 15.75 milligrams in one nostril and then 15.75 milligrams in the other nostril, totaling the 31.5 milligrams of the Sprix that's administered at that point in time. By the way, I would like to just alert you to the fact that there is the ability for those of you who are listening to ask questions if you like. I will see those questions, and at the end of the program, we'll go through some of them if we have the time. Now, what are the safety precautions associated with this? And granted, versus placebo, which you wouldn't expect too much difficulties with, you're going to get some increase in adverse reactions. But primarily, the adverse reactions that are going to be encountered really relate more to the administration of the drug via the nasal route of administration. To that end, 15% of the patients in the studies total of 455 patients, it may have exhibited some nasal discomfort or rhinalgia. Increase of lacrimation was another adverse reaction, but less so than the first two. And you can see down this list that as you get further along, the incidence of adverse reactions really was very, very minimal compared to placebo. In clinical studies, 1.5% of the patients treated with the Sprix experienced some serious adverse events or bleeding or hematoma at the operative site versus 0.4% that were treated with the placebo. And in those instances, the adverse reaction was hematoma. And as I mentioned, nasal discomfort and irritation, which occurred more frequently in the Sprix group compared with the placebo group, were generally mild to moderate, not necessarily worsened with repeated administration, and transient, lasting less than 5 minutes or so. Once again, to review the adverse reactions, the serious adverse reactions include cardiovascular thrombotic events, GI bleeding, ulceration, and perforation, hepatotoxicity, hypertension, heart failure and edema, renal toxicity and hyperkalemia, anaphylactic reactions, serious skin reactions, and hematologic toxicity. And in patients taking ketorolac, the generic for Sprix, or other NSAIDs for that matter, in clinical trials, the most frequently reported adverse reactions in approximately 1% to 10% of the patients are GI types of symptoms, including abdominal pain, constipation, diarrhea, dyspepsia, flatulence, GI fullness, GI ulcers, things of that nature. There are other types of adverse reactions as well reported, including abnormal renal function, anemia, dizziness, drowsiness, and so on. But we're talking about minimal incidence overall in terms of patient experience. On the right side of this slide, you can see how the Sprix is packaged and how it's provided to you. When you prescribe Sprix for your patients, it's provided in a box with 5 of these vials, which are single-day nasal spray bottles. And each of those bottles is capable of providing 4 31.5 milligram dosages throughout the day. Again, it's used with 1 spray in each nostril every 6 to 8 hours as needed for pain. Once the delivery device has been primed, it's a spray in the one nostril and a spray in the other nostril, totaling the 31.5 milligrams. Now, you should be aware of the fact that for patients who are over the age of 65, by the way, when I first saw this, I said, I got to be careful in the next couple of years because that could be, in any event, for patients who are over the age of 65, or patients who are under 110 pounds, or renally impaired, the recommended dose is going to be half of that. 1 spray in only 1 nostril, again, administered every 6 to 8 hours as needed. It can be administered as many as 4 times a day, up to 4 times a day, and can be administered for a total of 5 days. And for that reason, when the prescription is written, your patient or you, depending upon if you have the medication shipped directly to you or to your patient, will be a box of 5 bottles. Of course, you don't want to continue treatment for a patient on any drug unnecessarily any longer than it should be, at any more than the optimal amount. So if a patient is no longer experiencing discomfort from the surgical procedure, the Sprix should be terminated. Now, again, that safety information we talked about, we have to be careful of drug interactions. And here it would be interactions with drugs that interfere with hemostasis, where you may get an increased risk of serious bleeding with the use of anticoagulants or antiplatelet agents, selective serotonin reuptake inhibitors. These are the types of drugs we have to be careful about when we're dealing with SPRICS, as with any NSAID for that matter. ACE inhibitors, angiotensin receptor blockers, also may diminish the antihypertensive effects of these drugs, so we have to monitor blood pressure. ACE inhibitors in elderly or those who may be volume depleted or those with renal impairment may also result in deterioration of renal function. And we have to monitor for signs of worsening renal function in those patients. In the presence of diuretics, it may reduce the effect of the loop diuretics, and once again, it's just caution that has to be exercised. And finally, with this digoxin, it has been reported to increase the serum concentration and prolong the half-life of the digoxin. I'm sorry, a couple more here. Patients who are pregnant starting at 30 weeks gestation, there is a concern about the premature closure of a fetal ductus arteriosus. So you want to avoid the use of this drug in pregnant women starting at the 30th week of gestation. There are some other some other limitations. It should not be used concomitantly with oral ketorolac, aspirin, or any of the other nonsteroidals. So if you're going to be prescribing SPRICS, it's not something to be used in addition to other nonsteroidals, but rather in place of. Now, that doesn't prevent you from combining SPRICS with other types of drugs where there is not an interaction with the nonsteroidals, such as a drug like acetaminophen, which has been shown in some articles in the literature to work synergistically with the nonsteroidals to provide good pain relief. And there is no such limitation with SPRICS as well. So again, in certain specific populations, the pregnancy population, use of NSAIDs during the third trimester would increase the risk of premature closure of the fetal ductus arteriosus and therefore should be avoided in pregnant women over the 30th week of gestation. In addition, NSAIDs have also been associated with irreversible infertility. So you may want to consider withdrawal of SPRICS in women who have difficulty conceiving. Now, as far as overdosage is concerned, symptoms following acute NSAID overdose have been typically limited to lethargy, drowsiness, nausea and vomiting, and epigastric pain, which have been generally reversible with supportive care. GI bleeding has occurred, as well as hypertension, acute renal failure, respiratory depression, but these are extremely rare instances and not something that is typically encountered when using SPRICS, ketorolac, or any of the other nonsteroidals for that matter. How do you prescribe this? This is not a drug that's going to be available to your patient from their local pharmacy. In fact, the only way this drug can be provided to the patient is through Cardinal Health Specialty Pharmacy, which is located in Maryland. And there are a number of different ways in which you can write a prescription for the drug so that your patients can get that drug. In ordering SPRICS, there's a toll-free number that can be called where you will speak to a licensed pharmacy technician who collect the necessary patient information and enable you to complete the prescription process. Or you can actually fax a SPRICS direct prescription form to the Cardinal Health Specialty Pharmacy. In states like New York, where we are limited to electronic prescribing or e-prescribe, you can also order SPRICS via that method. Now, how does the drug arrive? The drug can be delivered in one of two ways. It can be delivered directly to the patient's home by overnight mail from the Cardinal Health Pharmacy. That means that you have to have a little bit of anticipation and preparation ahead of time. It's not something you can do on the spot if you have a surgical procedure that is an emergency. However, if you anticipate appropriately that you're going to be needing post-operative analgesics for a surgical procedure or an endodontic procedure or some type of other operative procedure, with proper with proper prior planning, this drug can be prescribed in one of the three ways I've detailed for you, so that the drug can be either delivered to the patient, or instructions can actually be given to Cardinal Health for the drug to be sent directly to you as the practitioner for you to dispense to the patient when they come to the office for the surgical procedure. Now, there is a health insurance requirement for this drug in order for your patients to be able to get the drug. Cash paying patients are not going to be eligible for Sprix. In fact, patients are not eligible if prescriptions are paid by any state or other federally funding program, including but not limited to Medicare or Medicaid, Medigap, VA or DOD, or where prohibited by law. So there are certain restrictions with regards to that. But if your patients have health insurance and they have the ability to have third-party payers take care of the prescription, the drugs will be sent either directly to them or directly to you if you would prefer. I see that a number of questions have been coming in now, and I just want to let you know that we're going to be going through those questions once we get past the formal part of the program. So please be patient with me, and we'll try to get through the rest of the presentation, and then we'll have some time for some questions at the end of the program. So, kind of summing up, Sprix being the first and only intranasal nonsteroidal anti-inflammatory drug that provides pain relief at the opioid level, is indicated in adult patients for the short term, and by that we mean up to 5 days, the short-term management of moderate to moderately severe pain that requires analgesia at the opioid level. It truly is a novel formulation of ketorolac-tromethamine, and it is a very potent NSAID. What's unique about this delivery mechanism is that it's rapidly absorbed through the nasal mucosa. The volume of liquid that is being placed there is minimal and is rapidly absorbed. What also is beneficial about this is it's not narcotic. And for that reason, you don't have the issues of opioid administration that have been kind of flooding our literature and the public domain as well. The other issue here is that the total duration of use of this drug and other ketorolac formulations should not exceed 5 days, and that's very, very clear. In fact, when ketorolac was first introduced as an oral version, there was that same restriction. But usually by 5 days, most post-operative pain that is minimal or moderately severe can be adequately managed with this drug. Okay, so we have a few questions here, and I'm going to see if I can get to those questions. Let's see if I can get to the full questions here. Let me go to the top, and I'm going to start from the bottom here. Okay. Is Sprix available through Canada is one of the questions from one of our listeners. And I'm not aware that Sprix is available in Canada just yet. In this particular situation, Sprix is being provided from Septidont. So, but Eagleette is also a distributor of Sprix for the non-dental population. I would have to defer to the representatives from Septidont to have better information with regards to whether or not it's available in Canada. Okay, let's go along here. The question here about cost. With the insurance considerations that we've been discussing, the fact that patients have to have insurance, it is of no cost to the patient. In fact, this is fully paid for by the insurance company, so that it's a net zero cost to the patient. Another question comes in, is it only used for maxillary surgeries? Can it be used for mandibular pain? Understand that the administration of this drug through the nasal mucosa is merely the mechanism by which the drug is getting into the circulation. In fact, we talked about 2 studies where we were trying to manage abdominal pain or orthopedic pain. So in those instances, it didn't matter the route of administration. So the transnasal administration of this drug is simply the mechanism where you get the drug into the circulation. Now, from one of the representatives from Septidont, the answer with regards to the availability in Canada, I'm told that it is only available in the United States. However, you should be aware that there is a $0 copay program that's still in place. Okay, let's go back to some of these other questions. Okay, there's a lot of interest in this use of this in Canada. There was one question that was regarding comparison to morphine. And the 2 studies that we really are utilizing right now is comparing the use of Sprix versus placebo, where the patient-controlled analgesia is available as the medication for breakthrough pain. So I would imagine that a lot of these studies that are being asked, or potential for studies that are being asked, comparing intranasal ketorolac to, say, ibuprofen or the use of other analgesics, have yet to be done. And I would imagine that at some point in time, these would be certain things that investigators may want to look at. Of course, the use of the drug has not really gotten widespread appeal just yet, and that will hopefully happen in the time to come. Let me see, I'm looking, one comment here where the questioner is saying that this drug could be used in the office after oral surgery while patients are numb and have difficulty swallowing large 400 milligram ibuprofen pills. And that's really one of the beauties about this drug, is that it can be administered, because it's being administered intranasally, the issues of swallowing a pill, especially when someone is numb and doesn't have full control of their swallowing apparatus, their tongue, whatever, this will enable that drug to get on board prior to the local anesthesia that's been administered dissipating. But there's another patient population that may be very helpful here, and that would be the special needs population, where the ability to really swallow any type of pill is impaired significantly because of their disability. In that situation, this would be the perfect drug for use as an analgesic. Small volume and easy to administer, especially to someone else. One other question that's come up here is, will it become available at our pharmacies soon? I would defer to our friends from Septidont to give me a little bit more insight as to that answer. So what kind of procedure do you think this would be useful for in dentistry? Again, I would say any surgical procedure where postoperative analgesia would be indicated. Now, we're all professionals and we'll kind of have an idea of what types of procedures we usually will prescribe analgesics for. I would say periodontal surgery, implant surgery, surgical removal of teeth, any type of grafting, endodontic procedures. Postoperatively, sometimes there'll be an indication for the use of postoperative analgesics. So the timely administration of the Sprix and then the follow-up of the Sprix will enable our patients to maintain a blood level that's going to be very effective for the postoperative management of pain. As with any drug, I don't think that you're going to see repeated exposure resulting in tolerance. This is not a narcotic. This is a non-steroidal that works along that pain mechanism. Okay, let's see if we have any other questions here. All right. far as recommendations for women breastfeeding, there are no contraindications that have been mentioned for breastfeeding. So I don't see that as being an issue. It's not in the package insert, and we've gone through the contraindications and the warnings pretty significantly, and I would imagine if that was an issue, that would be very plainly detailed in the contraindications. Now, as far as the pharmacies other than Cardinal Health, I'm told that there are really no current plans in the offing right now for this drug to be made available in those venues. So for the time being, it's going to be something you're going to have to prescribe from Cardinal Health. Understand a couple of things about the use of the drug. This is a drug that needs to be refrigerated. So when you receive it, it'll be in some type of an ice pack. This is one of the reasons why most pharmacies won't be able to carry it. So it's going to be sent to you I guess with dry ice that will enable you to keep it cold. It'll be cold and transport to you and be kept cold in your refrigerator if you're going to the patient. If the prescription is going to be sent directly to them, they will receive it the same way and will be told that it needs to be refrigerated. Okay, and just to be clear on that, the Sprix is shipped in a cooler with a blue ice pack. Now, someone has commented that the drug is not advisable for breastfeeding moms, so I just want to make sure that we were clear about that. Each of the 5 vials that comes in the box does not get activated until it's actually physically activated by your patient or you. Once that vial has been activated, please bear in mind that administration is only for the 24 hours period immediately afterwards. Therefore, for the 5 days, for the 5 days that are being administered, you will get 5 unique vials, one for each of the 5 days. And at the end of the 24-hour period, the first one's discarded, and the next day you go to the second vial. This way, you're sure you're not using stale product for your patients. So it seems like we've answered many of your questions, and I appreciate the opportunity to share some of my insight with you with regards to Sprix. Again, in my experience in the hospital, administering anesthesia for patients who are under general anesthesia, ketorolac is a drug that we use all the time intravenously because of the ease of administration venously and the efficacy that it provides postoperatively in terms of analgesia. It's a great drug. The fact that we now have another mechanism, another route of administration that would make it easier for patients to administer it by themselves at home, this really provides a very unique opportunity for patients to control postoperative pain in the following dental procedures. As you look on the website from Septidon for Sprix, you will learn more about how this can be administered. Cardinal Health is, again, the pharmacy that is able to distribute the drug, and the instances where it's been used has really provided profound analgesia, thereby obviating the need for any type of opioid in postoperative pain management, which really in today's culture, in today's day and age, is something that we as health professionals probably should be trying to avoid as much as possible. This way we don't get into issues of diversion that can cause issues with our younger patients, our teenagers, over the age of 18, of course. For the drug can't be used under the age of 18, but for those patients where maybe surgical removal of third molars is being considered, this is a very appropriate analgesic that has very significant effects. Okay, let's see. Let's see. I have a few more. It's not on this. Okay. I was informed that you should not go to the Septidon website, but rather go to www.sprix, sprix.com, to learn all of the prescribing information with regards to the drug. Okay. I see no additional questions, and I want to thank you for being very attentive. We've kept this under an hour, as I promised, and I hope you gained some useful information here that will be helpful to you as you move forward, and that you may consider Sprix as an analgesic that's going to be of value to you in your practices. And with that, we're going to end the webinar, and for all of you, have a very pleasant evening. Thank you for being so attentive.